You said that a pulse of 120/80 is normal. Does that mean healthy, and does that mean ideal?
A
What?
blood pressure that is naturally lower than 120/80 in somebody who's not on medications, that is ideal. If your blood pressure is naturally under 120/80, your risk of heart attack or stroke is significantly lower than somebody whose blood pressure is naturally above those levels.
Right, great. Is grass-fed beef better than non-grass-fed beef? Is there any research that supports that? So many people are, think they're being healthy because they're eating grass-fed beef. What are your thoughts on that?
To my knowledge, there is not a substantial difference between beef that is fed grass and not fed grass.
Okay, thank you. And what do you think about the new meats, the Beyond Burger and the Impossible Burger? Are they okay for our health? Are they at least better than the foods that they're substituting?
Well, first off, I will freely admit I think they're delicious. But to be truthful, looking at their ingredients, I mean, they're not ideal, foods that should be consumed on a daily basis. And they have added oils, and I think one of them contains a fair amount of coconut oil and saturated fat, and both contain a significant amount of sodium. So I think they're a reasonable portion. They can be a reasonable component of a plant-based diet as long as they're not consumed on a daily basis. I think that one of the companies did do a study looking at cholesterol levels or of consuming their plant meat versus consuming hamburgers, and I think they've noted a difference where the plant meat had better health outcomes. Off the top of my head, I don't recall the details of the study, but in general, I think if you love animals, sure, it's okay to incorporate a plant burger here and there sparingly in your diet.
And have you seen any research on what happens to the people who are eating the carnivore diet, or the one that's like basically all meat?
Yes. I don't know that I'm familiar with any research, but just intuitively, it doesn't seem like a good idea.
Okay. Yeah. Okay. That makes sense. That makes sense. And what are your thoughts on colonoscopies? It's sort of outside your
Well, a little outside the scope of my presentation. I think that colonoscopies are an important part of reducing risk of colon cancer. For the right risk person. At this point, there's something new called Cologuard, which is good for people over the age of 45 who are at relatively low risk of colon cancer. And those who are at higher risk of colon cancer, a colonoscopy is an invasive procedure that's relatively low risk to look for early signs of colon cancer, which is a preventable cause of death.
Thank you. Are there pharmaceutical drugs that actually contribute to heart disease that people should watch out for?
I know that there are a few chemotherapeutic agents that raise cholesterol. I do have one of my patients who's on one of those medications. He also has carotid artery disease, so he has vascular disease, and this medication that is to keep his lung cancer in check is also greatly raising his cholesterol levels. So in order to reduce his risk, I have him on an injectable medication for cholesterol in addition to his statin medicine. That is the one medicine that I can think of that specifically increases risk of heart disease in a substantial manner.
Thank you.
Oh, and also some of the HIV agents as well can lead to abnormalities in the lipids.
Okay, thank you. Well, are there alternatives to those drugs for those particular diseases, or are they kind of stuck with consequences?
I honestly don't think so. I don't know, a little outside of the scope of what I do as a cardiologist.
Sure. So I mentioned doctors and with regard to their nutritional knowledge. What about dietitians? Do you like conventional dietitians? Do they seem to understand the power of a plant-based diet with regard to heart disease and other health factors?
It's a good question. In my limited experience in interacting with dietitians, I think at least the ones that I speak with are more aware of plant-based diets and are less likely to poo-poo them as being something that's a fad, and to recognize that there is substantial health benefits to adopting a plant-based diet.
Thank you. And a lot of people think they're eating heart healthy when they eat fish. Are there benefits? Are there health benefits to eating fish, specifically with regard to heart disease?
If you look at somebody who's consuming a standard American diet and you add fatty fish to that standard American diet, their heart health is potentially going to improve based on some of the studies looking at that. The dilemma with consuming fish is that, yes, it has omega-3 fatty acids, which are healthy for the heart, but also there are potential negatives to consuming fish, such as the toxins and the mercury and things that are in the water that the fish consumes and is in their body. And also fish have a considerable amount of cholesterol in them as well.
All right, great. Thank you so much, Doctor. Okay, that's going to conclude our Q&A session. So thank you so much. Oh, actually, we got one more question. So I'm going to give Steve Friedman the opportunity to ask one more question. Steve, please state where you're from and ask your question.
Hi, Dr. Shenkman. Steve from Rockaway, New York. Just a quickie. Where do you stand on the controversy on healthy plant-based fats when it comes to cardiovascular protection? We've got Dr. McDougall on one side. We've got Dr. Esselstyn also. And then on the other side, we've got Dr. Furman. It's cardiovascular health. It's brain health. That's my question.
Okay, great. We need to consume fats. The data for very low fat diets, I mean, you've got Ornish's small trial, you've got Esselstyn's small trial. But in general, I am not somebody who's advocating for a very low fat diet. I don't think it's, quite frankly, it's not necessarily palatable, not necessarily satiating. I think, consuming healthy fats is a beneficial thing. So fats from avocados and from nuts can be beneficial and can be healthful.
Great. Thank you so much, Doctor. It was very informative. So we're really going to quickly open up the mic so everyone can also in the audience say thank you. So you'll hear a whole cacophony of thanks. So.
Thank you.
Thank you. It's very informative. Good luck with the rest of the.
Great.